Hey guys, Dr. Bergmann here at Rosemary Jones Chiropractic. This week's video we're going to be talking about scoliosis in the spine and talk about how it can develop at different stages, whether it's pre-adolescence, through your adolescence, or even once you're an adult. So last week's video we showed Jonathan, Dr. Joe's son, with his backpack, and that's one way at an early age that kids can start to develop some curvatures in their spine. If they're carrying their backpack incorrectly, or like we showed on the video, if he's carrying it with just one strap, it'll cause one shoulder to go down. When I was a kid, I was an avid golfer, and back then they didn't have double straps for the golf bag, so I'd carry my golf bag on one shoulder. So baseball bags can be heavy, softball bags can be heavy. So if kids have those things, it's important to make sure that they have those backpack straps on there and they're carrying them appropriately. Now once they get into the adolescence, female adolescents are actually at the highest risk of developing scoliosis. The ligaments in females are naturally more flexible than in men because women are childbearing, and they will be childbearing through their life. So when they start to go through their growth spurt, if something's out of place or something's misaligned, you can start to develop a curvature into that spine. And girls, once they start to go through their growth spurt, when they start to develop, that curvature can start to develop. And if it's not caught soon enough, that's something that can progress and get worse as she continues to get older. Now, men can also get scoliosis. It's not saying men are immune to scoliosis. They can as well, but it's not quite as prevalent as it is in females. So the way that we can detect it here at the office is to do a scoliosis screen, but sometimes those can even be hard to detect. So we can take x-rays at the office as well. So we've got a picture of what scoliosis looks like on x-rays. We'll take a look at that here and kind of show you what that process looks like. So this is what scoliosis looks like on x-rays. You don't really need to know that much about x-rays to tell that this doesn't really look like it should. You can see how it curves throughout the spine here. So this is actually an x-ray of my wife. And she has scoliosis in the lower back and the lumbar spine. She's got a 14-degree curvature, and in the thoracic spine she's got a 17-degree curvature. So anything over 10 degrees is considered a scoliosis. Now, a lot of times people will say, well, you have scoliosis, there's nothing that can be done about it. That's just the way that it's going to be, and that's not necessarily true. With chiropractic care, we can help reduce some of these curvatures. Will it ever be back to zero again? It probably won't in her case, but we can make it better. When we took x-rays about 5 years ago, she had a 20-degree scoliosis, or a 20-degree curvature in the low back and a 22-degree curvature in the mid back. So we can reduce it over time. Now granted, she's been getting a lot of care. She has the benefit of me being her husband, and I can adjust her more frequently, but there can be changes that are made. So when this starts to happen, when these curvatures start to develop, you're changing the center of gravity. The curvature wants to go this way. So as she continues to develop and get older, in kids, or they start to gain weight and mature, the spine is going to want to curve out more. It's going to want to bow more because there's more weight pressing down. So the more it's shifted off the center of gravity, the more it wants to continue to go in that direction. Now, we've seen a lot of patients that are older, 60s, 70s, and they get a lot of osteoporosis and degeneration there, and it can cause a lot of problems as you get older. So it really helps and makes a difference if we can catch this when they're younger, when they're 11, 12, 13 years old, and are still maturing and developing, because we can correct that and get it to zero, maybe not, but we can certainly make sure that it doesn't continue to get worse as their spine matures. So if you think your child may have scoliosis, or if they're complaining of back pain and they're kind of in that zone of 10 to 14 years old, it's a great idea to really bring them in, get them checked, and make sure that there's not something that's developing that we could check, treat, and try to prevent from becoming a problem in the future. So if you've got any questions, let us know. Again, I appreciate you guys watching. I'm Dr. Dave Bergmann here at Rosemary Jones Chiropractic.